Imagine being able to see inside the human body without even making an incision. That's the remarkable capability of computed tomography, more commonly known as a CT scan. This powerful imaging technique uses X-rays to create detailed cross-sectional images of our internal structures. CT scans are like taking X-ray pictures from various angles and then using a computer to combine them into a comprehensive view. This allows doctors to diagnose a wide range of conditions, from broken bones and internal injuries to tumors and infections. Since their introduction in the 1970s, Connecticut scans have revolutionized the medical field, providing invaluable insights into the intricacies of the human body. They have become a crucial tool for diagnosing and monitoring a wide range of medical conditions. Whether it's assessing the extent of a traumatic injury, detecting cancerous growths, or guiding surgical procedures, Connecticut scans have become an indispensable part of modern medicine, enabling healthcare professionals to make faster and more accurate diagnoses. A CT scanner might seem like a complicated piece of machinery, but the principle behind it is surprisingly simple. At its core, a CT scanner consists of three main components: an X-ray tube, radiation detectors, and a motorized table. The X-ray tube, similar to the one used in traditional X-ray imaging, emits a narrow beam of X-rays that pass through the patient's body. As these X-rays travel through different tissues, they are absorbed or attenuated to varying degrees. Positioned opposite the X-ray tube are highly sensitive radiation detectors, which measure the amount of X-ray radiation that successfully passes through the body. These detectors play a crucial role in capturing the subtle differences in X-ray attenuation, which form the basis of CT images. The patient lies on a motorized table that slowly moves through the circular opening of the CT scanner, called the gantry, while the X-ray tube and detectors rotate around them. This synchronized movement allows the scanner to capture X-ray data from multiple angles. Over the years, Connecticut technology has advanced significantly, leading to the development of faster and more sophisticated scanners. One such advancement is the helical CT scanner, also known as a spiral CT scanner. Unlike older sequential CT scanners, which captured images one slice at a time, helical CT scanners employ a continuous spiral movement of the X-ray tube and detectors around the patient. This allows for much faster scan times and the acquisition of thinner slices, resulting in more detailed images. The continuous data acquisition of helical CT scanners enables the reconstruction of images in any desired plane, providing a comprehensive view of the anatomy. This is particularly useful for imaging blood vessels, airways, and other complex structures. Helical CT scans have become the standard in most clinical settings due to their speed, accuracy, and ability to generate high-resolution three-dimensional images, revolutionizing the way doctors diagnose and treat various medical conditions. Before the advent of helical CT scanners, sequential CT scanners were the mainstay of medical imaging. As the name suggests, sequential CT scanners capture images one slice at a time. The X-ray tube and detectors would move incrementally, stopping to acquire an image before moving on to the next position. While sequential CT scanners were groundbreaking in their time, their scan times were significantly longer compared to helical CT. This was because the table had to pause for each slice to be acquired, limiting their use in certain clinical situations, especially emergencies. Despite their limitations, sequential CT scanners still hold value in specific applications, particularly in situations where precise alignment of images is crucial, such as radiation therapy planning. However, with the advancements in helical CT technology, sequential CT scanners have largely been replaced in modern medical practice, paving the way for faster and more efficient imaging techniques. Section 5. Painting a clearer picture. Contrast agents in CT scans. Sometimes the natural contrast between different tissues in the body may not be sufficient to clearly visualize certain structures or abnormalities. In such cases, contrast agents, also known as contrast media, are used to enhance the visibility of specific organs, blood vessels, or tissues. Contrast agents are substances that absorb X-rays differently than surrounding tissues, making the areas where they are present appear brighter or darker on CT images. This enhanced contrast allows doctors to better differentiate between normal and abnormal structures. Depending on the area being examined, contrast agents can be administered orally, intravenously, or rectally. For example, an oral contrast agent might be used to visualize the digestive tract, while an intravenous contrast agent can highlight blood vessels or tumors. The use of contrast agents in CT scans has significantly improved the accuracy and sensitivity of diagnoses, allowing doctors to identify subtle abnormalities that might otherwise go unnoticed. As Section 6, decoding the images, understanding Hounsfield units. CT scan images are displayed in shades of grey, with each shade representing a specific level of X-ray attenuation. To quantify these attenuation values, a standardized scale called the Hounsfield scale, or HU, is used. The Hounsfield scale is named after Sir Godfrey Hounsfield, one of the inventors of the CT scanner. On this scale, air is assigned a value of -1000 HU, while bone is assigned a value of +1000 HU. Water, which is used as a reference point, has a value of 0 HU. Tissues and structures in the body fall somewhere between these extremes, with their Hounsfield unit values reflecting their density and ability to absorb X-rays. For instance, fat typically has a lower HU value than muscle, while organs like the liver and kidneys have intermediate values. By analyzing the Hounsfield unit values of different structures in a CT scan image, radiologists can accurately characterize tissues, identify abnormalities, and make informed diagnoses. Section 7, Safety First, Radiation Exposure and Precautions. While CT scans are generally safe, it's important to acknowledge that they do involve exposure to ionizing radiation, which has the potential to damage cells and increase the risk of cancer over a person's lifetime. The amount of radiation used in a CT scan is carefully controlled and kept as low as reasonably achievable, ALARA, to minimize potential risks. However, it's essential to discuss the benefits and risks of a CT scan with your doctor, especially if you are pregnant or have concerns about radiation exposure. To ensure patient safety, medical professionals follow strict safety protocols when performing CT scans. This includes using appropriate shielding to protect sensitive areas of the body from unnecessary radiation exposure. Advancements in CT technology, such as iterative reconstruction techniques, have also led to significant reductions in radiation doses without compromising image quality, further enhancing patient safety. Section 8, Advancements and Innovations, the future of CT scanning. The field of CT scanning is constantly evolving, with new advancements and innovations emerging all the time. These advancements are aimed at improving image quality, reducing radiation exposure, and expanding the clinical applications of CT. One such advancement is the development of photon-counting CT scanners. Unlike conventional CT scanners, which measure the total amount of X-ray energy absorbed, photon-counting CT scanners can detect and count individual X-ray photons. This ability to measure X-ray energy levels directly provides richer information about the composition of tissues and allows for more accurate material differentiation. Photon-counting CT has the potential to revolutionize various aspects of medical imaging, from cancer detection to cardiovascular disease assessment. Another area of active research is the development of artificial intelligence, AI-powered CT analysis tools. These AI algorithms can assist radiologists in interpreting CT images, identifying subtle abnormalities, and improving diagnostic accuracy. Section 9. A powerful tool for diagnosis and treatment, the importance of CT. Since their introduction, Connecticut scans have become an indispensable tool in modern medicine, playing a crucial role in the diagnosis and management of a wide range of medical conditions. Their ability to provide detailed cross-sectional images of the body has revolutionized the way doctors visualize and understand internal structures. From diagnosing traumatic injuries and detecting tumors to guiding surgical procedures and monitoring the effectiveness of treatments, Connecticut scans have become an integral part of patient care, leading to faster diagnoses, more effective treatment plans, and improved patient outcomes. As technology continues to advance, we can expect even more sophisticated CT scanners with enhanced capabilities, further solidifying their importance in the future of healthcare.